Peace be to you. Assalamu alaikum. This is Omar Abdul Malik, physician assistant and health educator. So I thought today I would talk about physician assistant, as I usually do, but I just want to maybe redress the fundamentals of what a physician assistant is. I hear a lot in the news about the doctors and nurses and others, other healthcare providers who are succumbing to the COVID-19 virus. And, a lot of them have gone to places like New York, the so-called ground zero. I hear doctors and nurses, and other healthcare providers. Well, as a physician assistant, I'm one of those others. I'm here in Washington, D.C., and we've got COVID cases here. In fact, one of the first healthcare providers to be known to be infected with the COVID-19 virus is a physician assistant. I think his name is James Kai, early 30s, but God willing, he's going to get better. So here it is. What is a physician assistant? So a physician assistant is a medical provider. Like myself, we're licensed in all of the states, all 50 states, and Washington, D.C., to write prescriptions and come up with treatment plans and diagnosis for our patients. Right now, U.S. News and World Report has named physician assistants the number 3 job in the U.S. and the number 2 job in healthcare. And that's a good thing to know. Right now, I think there's about 10 million people who are unemployed in the U.S. You might want to consider becoming a PA. It's a great position, a great career. I've been a PA for 20 years now and still loving it. Right now, there's about 150,000 physician assistants in the country that are medically licensed and working. This is compared to a little over 4 million nurses. And within the nurses, I believe that includes LPNs, 2-year RNs, and those with BSNs, Bachelors of Nursing. And there's over 1 million physicians of varying specialties. So our number, our paltry 150,000 really, and that's a round off. It really, pales in comparison. So now would be a very good time to consider a career as a PA. Right now, according to the Bureau of Labor and Statistics, PAs on average make about $110,000 a year, which is pretty good. That's well over the national average of the average household income, which I think is about $60,000. Now, this of course varies by specialty. The highest paying specialties are surgery, emergency medicine, and hospitalist medicine. So I'm a hospitalist PA. Typically, those salaries range, between 120 to 180,000 per year. This is including benefits packages and things like bonuses. And that's going to vary by one's experience and location, of course. The education that it takes to become a physician assistant, it requires a master's degree. So you've got to do a 4-year undergraduate degree. I did a video about the best major for physician assistants. I'll do another video about that, God willing, inshallah. Then after getting the 4-year undergraduate degree, you do a 2-year graduate program in physician assistant. And this is broken up into 1 year of didactic studies, which includes anatomy, physiology, pharmacology, clinical chemistry, physical diagnosis, pathophysiology, and then your specialty courses, clinical medicine, psychiatry, pediatrics. And then there's a year of clerkship. And the clerkships last 4 to 6 weeks, really depending upon the program. So the clerkships deal with the specialties. So OBGYN, pediatrics, surgery, internal medicine, emergency medicine, psychiatry. And then some programs offer the students an opportunity to do an optional rotation, like something like forensics or ophthalmology. And the student usually gets to choose that if they can find somebody to mentor them during their clerkships. So I should say this, as physician assistants, we have to work under the license of we have our own medical licenses, but we also have to work under the supervision of a licensed physician. And it doesn't mean that the physician is going to be right over your shoulder. I'll do another video, inshallah, about, Lord willing, about my relationship with my supervising physicians over the years. Yeah, they don't want to be breathing over your shoulder. They have other things that they can do. That's the whole purpose of having a physician assistant work with you. So the history of physician assistant was started about 1967 at Duke University by Dr. Eugene Stead, and most of those students were corpsmen, medical corpsmen coming out of the armed forces. And the PA program, it really allowed them to utilize their skills in the civilian capacity. So for more information, you can go to the American Academy of Physician Assistants and the National Commission on Certification of PAs. Oh, let me say this, sorry. So with the entrance exam, I should have put this up here with education, but the entrance to PA programs is very, very competitive. At minimal, as far as I know, most of the programs you need a minimal GPA of a 3.0. That's out of a 4.0. To be a strong candidate, you really should have a 3.5. I've talked about this in other videos. And the GREs, you want at least 300 and above. You got to have at least 2,000 hours of direct patient contact care. This includes being a certified nursing assistant. That's what I did for several years before applying to PA school. Phlebotomy can work. Medical assistant or an LPN. These courses usually take, they vary in lengths from several weeks to several months, but it's an easy way to quickly acquire direct patient contact hours. Many schools require that you have as many as 2,000 hours. You want to make yourself as competitive an applicant as possible. I've done other videos about that, so I'll do another series. But that's all for now. If you have any questions, please leave your questions in the comment sections. For those of you all who think that you may be interested in a physician assistant career, I'll make myself available to you and try to help you to the best of my ability, God, Lord willing. So I ask you all to try to be safe during this COVID virus pandemic. Know that if you become a PA, you'll be able to be an integral part of the healthcare system and join the battle against this COVID-19. All right, peace. You guys be safe.